This is a 69-year-old man who has been referred for a dilated cardiomyopathy noted on echocardiography. I like to begin with the coronary arteries. This is a 3D view. You can clearly see that there is some disease in the proximal left anterior descending, probably obstructive, but there is clearly good flow down the LAD into the circumflex vessel, as well as the obtuse marginals and also into the right coronaries. Looking at the left ventricle, we have general views here that allow us to look at mutually orthogonal situations, short axis, vertical long axis, and horizontal long axis according to standardized methods. You can see that the left ventricle is significantly dilated and that there is global left ventricular dysfunction, systolic, estimated EF about 25%, global hypokinesis in multiple levels. Also, you can see the left ventricular volume curve clearly shows poor systolic function and also poor diastolic function. Turning again to look at the left ventricle in a little bit better view, we go into a left anterior oblique view that is very similar to what we might see for a left ventricular short axis view. Kind of get that into the range and then start looking at the ventricular function. You can again see that there is a dilated left ventricle with very poor left ventricular systolic function and generalized global hypokinesis. We can do some orthogonal imaging in this way by looking at an orthogonal plane through that short axis view shown on the left is a long axis 90-degree view, again suggesting perhaps that there even is some apical dyskinesis, but no clear thinning of the left ventricular walls at any point. Looking at the coronaries again, we're going to make a cine angiogram view of the left ventricular area, and then of the coronaries you can again see that the coronaries are widely patent. In the LAD there clearly is a significant disease in that region, but if you look at this, this is a non-ischemic cardiomyopathy because all the vessels are open, there is no regional wall thinning, and there is clearly out of proportion severity of left ventricular function compared to the degree of coronary artery atherosclerotic disease.